Welcome to the Kaiser Permanente Miss Clinic's three-part web series on vaginoplasty and other genital surgeries. This webinar will focus on vaginoplasty aftercare. If you have not listened to Part 1 and Part 2, we recommend listening to those sections first. Vaginoplasty surgery is performed in the hospital under general anesthesia and usually takes about 4 to 6 hours. It's better to arrive to the hospital early the day of surgery than too late. If you have had negative reactions to anesthesia or pain medications in the past, please let your surgeon and your anesthesiologist know so they can make appropriate accommodations. After surgery, you will recover in the post-anesthesia care unit. It's normal to have a range of emotions after surgery. Some people experience some mild depression as a side effect of anesthesia and narcotic pain medication. Other common side effects from anesthesia include temporary short-term memory loss and nausea. Hydration after surgery can reduce some of the effects of the anesthesia. After vaginoplasty, patients typically stay in the hospital for about a week. Primary tasks while in the hospital include resting, managing pain, preparing for discharge, and learning about aftercare. The hospital nursing team will encourage patients to get up and walk slowly in the hospital after surgery. This assists with healing by encouraging blood circulation. During surgery, a catheter will be inserted in the bladder to help the urine exit the body without using the urethra to urinate. Most people will have their catheter removed before they are discharged from the hospital. After surgery, the vaginal canal is kept open with packing or gauze. There will also be gauze covering the incision sites and the opening to the vagina. The packing is usually removed from the vaginal canal about 6 to 7 days after surgery while patients are still in the hospital. Once the packing is removed, the surgical team will provide instructions about dilation. Most people are off work or school for 6 to 8 weeks after vaginoplasty. If your regular lifestyle is physically demanding or you have complications from surgery, it's possible you may need more time off. Even though you may return to work or school after 6 to 8 weeks, many patients say it takes 6 to 9 months before they are fully healed. This varies from person to person. It's normal to experience pain after surgery, but we want to make sure that pain remains at low levels. It's easier to control pain before it gets to an intolerable level. Once the pain reaches a peak, it usually requires more time and more pain medication to get back to baseline. While you're in the hospital, please inform the nursing and medical team if your pain is not being controlled. Doses and frequencies may be able to be adjusted. In the hospital, you will likely have a PCA or patient-controlled analgesia, which is IV pain medication that releases when you press a button connected to a medication pump. Before discharge from the hospital, patients will be tapered to oral pain medication that they will be able to use at home. People with an addiction history or a history of negative reactions to pain medication are encouraged to inform their medical team so appropriate pain medication can be prescribed. If you're considering over-the-counter pain medications, please get approval from your surgeon first, as sometimes they can be contraindicated. As we discussed on the previous slide, some low to moderate level of pain is a part of normal healing. Swelling is also quite normal and can take a few months to resolve postoperatively. Sudden swelling is a concern, and in this situation, your surgeon should be contacted. Nausea and vomiting may also occur. It can be caused by anesthesia and pain medications, but it can also happen when a person is constipated. If the anesthesia or pain medication is causing your nausea vomiting, ask your nursing team for an anti-nausea medication. If you haven't had a bowel movement in 2 to 3 days, talk to them about how to help facilitate a bowel movement, as well as finding a way to decrease those medications that do cause constipation. If you find yourself itching, first identify if it's generalized or localized. If it's generalized or all over your body, it may be attributable to anesthesia or pain medications. If it's localized, you may be allergic to your adhesive dressings. Blood can be normal in the urine for up to 6 weeks, but any increase in blood in the urine or a change in the color from light to bright red should prompt a call to the surgical team. Once you are discharged home without a catheter, you should call your surgical team if you're unable to urinate, only urinating a small amount, or having symptoms such as burning, urgency, or lower abdominal pain. These may be indicative of urinary retention, and a catheter may need to be reinserted.
It's helpful for patients to have a support person in the hospital who can ask questions and recall important information. This is especially critical at discharge when patients are getting instructions from their care team. Patients will need someone to drive them home and help get them settled into their recovery space. It's recommended that people recovering from vaginoplasty or vulvoplasty have a caregiver around the clock for about 3 to 5 days after discharge from the hospital. Some people may need more round-the-clock support depending on their course of healing and physical and emotional needs after surgery. It's always helpful to plan for more days of help than too few. It's important that people recovering from surgery have at least one identified caregiver who can help them as they heal. Having a team of caregivers can be very helpful because recovery from surgery requires many weeks of care. Backup plans are recommended in case a caregiver is unexpectedly unavailable. You may decide you'd like to organize members of your care team using online care calendars that allow people to sign up for shifts and tasks. After surgery, people will need help with lifting, laundry, cleaning, meal preparation, errands, and care for children and pets for at least 4 to 6 weeks after surgery. It's important to have people available for emotional support, too. It is common for patients to think that they have more strength than they actually do in the first few months after surgery. Taking it slow at first is important. Gradually add on more activities as you are ready. If you have any medical concerns after returning home, contact your surgeon for further guidance. If your surgeon advises you to go to the emergency room, go to the nearest Kaiser ER and ask the ER doctor to contact your surgeon or the on-call surgeon at Kaiser SF Plastics. One very important part of lifetime maintenance after vaginoplasty is regular vaginal dilation. The care team will teach dilation on day 6 in the hospital after vaginal packing is removed. It's very important to follow these instructions exactly to avoid losing vaginal depth. If you have difficulty or pain with dilation, notify your care team right away for tips and assistance. If patients start to experience difficulty with dilation, they can utilize some of the following suggestions, such as increasing the frequency of dilation or increasing the amount of water-based lube being used. It's always a good idea to check in with your surgeon as well.
After vaginoplasty, the vagina will not be able to self-cleanse. In the hospital, the care team will show you how to douche. Starting on post-op day 8, you will clean the inside of the vagina 3 to 4 times per week using warm water and unscented Castile soap. Douching frequency will decrease over time. Due to the close proximity between the urethra and the anus, the risk of urinary tract infection increases. Wiping front to back after urinating or defecating will help prevent the spread of fecal material into the urethra. It is also important to note that urinary spray is common after vaginoplasty due to urethral swelling. If it persists, spray direction can be corrected with a second surgical procedure, sometimes combined with labiaplasty, for those individuals who feel they need further labial definition. Surgeons generally recommend waiting at least 3 months after surgery to have penetrative vaginal or anal sex. Check with your surgeon to see when it's okay to start. Clitoral stimulation can be initiated around 2 weeks after surgery or when the patient feels comfortable. People who have had vaginoplasty can also get or transmit a sexually transmitted infection. For patients wanting to reduce their risk of HIV infection, we have a team here at Kaiser that can prescribe PrEP, or pre-exposure prophylaxis, a once-a-day pill that greatly reduces the risk of HIV transmission. If you are interested in starting PrEP, please let anyone at the MISS Clinic know, and we can send a referral on your behalf to the PrEP team. Water-based lubricants can also help reduce tearing during penetrative sex and increase comfort. Healing times can be different, and it can be slow. Please do not hesitate to contact the surgical team with questions or concerns. Remember, it is important to abstain from smoking and exposure to secondhand smoke in order to promote healing. Thank you for joining us for this webinar. Please call the MST Clinic at 510-752-7149 with any further questions.